Hello, everyone. I welcome you to today's edition of our program, Focus on African Women's Health. This is a program that is committed to promotion of African women's health at home and abroad. We share the global message of health for all and continue to emphasize that African women must not be left behind in optimal health. In case this is the first time you are joining us on this program, my name is Dr. Olaide Ogunshiji of the School of Nursing and Midwifery, Western Sydney University, Sydney, Australia. Last week, we continued our conversation on oral health by associating it with some non-communicable diseases. We ended up the program last week by looking at how we can prevent oral health related complications when it has to do with issues of cardiovascular disease and diabetes. We'll be rounding up our conversation on oral health this week, and in rounding it up, I felt many women will be very interested in knowing how oral health can be associated with a number of pregnancy outcomes. And I've got here with me today Ariana Villarosa, who has been very generous in her time to be our guest for today. And without wasting much of our time, I will ask Ariana to quickly tell us something about herself.
Hi, everyone. I'm a PhD student, and I'm doing my research around Aboriginal women and their oral health during pregnancy. I've been in the research field for about 6 years now, but I'm trained as a podiatrist.
Thank you so much, Ariana. The first question I will ask you is, can you please quickly tell us how oral health issues are associated with pregnancy outcomes?
So, pregnant women are at risk of oral health issues, and this is because of a number of reasons. First of all, during pregnancy, I think as many pregnant women know, you have more dietary cravings, so you crave more food, particularly sugary foods, and this can increase your risk of getting dental caries, which are little holes in your teeth. Also, you have morning sickness, so the vomiting can also increase the acid in your mouth, which can also increase your risk of oral health problems. Finally, something that some women may not know is that there are changes in your hormonal variations, which basically affects your oral health. How this actually affects women's oral health is that it can actually increase their risk of gum disease. And this can come in the form of, say, bleeding gums. So in the literature, we know that 60 to 70% of pregnant women actually experience bleeding gums during pregnancy. And then 1 in 4 women actually experience a more severe form of gum disease known as periodontal disease. Now, it's periodontal disease that has been linked with poor adverse pregnancy outcomes. So things like having preterm birth, low birth weight, and preeclampsia. So unfortunately, however, there's no solid evidence in the literature to show that having periodontal treatment actually improves the outcomes of these adverse pregnancy outcomes. However, in saying that, we know that maternal oral health is a risk factor for your child's oral health. So we know that childhood dental decay is the most common chronic form of disease among children. So it's definitely an area that needs to be of concern among pregnant women.
Thank you so much. It's so fascinating to see, from what you have just said, that, oral health can, have a determining factor when women experience stillbirth and preeclampsia. Now, what I know is that your team have been doing some work with midwives in maternity wards. Can you please tell us some of your findings, just as many that you feel, comfortable sharing? Thanks, Ariana.
That's no worries. I think, I guess the first question is, why do we involve people who are non-dental professionals in this setting when clearly dentists have been, dominating the scene for quite some time? What we know from our research is that 1 in 3 women actually don't access the dentist during their pregnancy. And furthermore, even if they were to get oral health information from, say, a health professional, many of them aren't actually trained in oral health. So what we wanted to do was target a health professional that would actually be someone that the pregnant woman would trust for some information related to their baby and their oral health, and also someone that they would see routinely during their pregnancy. And of course, this is your midwife. So what we've done is that we've taken 2 strategies to actually, help pregnant women with their oral health. So the first one is actually with mainstream health services. And this is where the midwives come in. And we've actually developed a nationally recognized program for midwives, where they can also get points for their continuing professional development and to deliver oral health information to pregnant women. We've also developed a really simple screening tool for them to use just to ask women to determine whether they need to see the dentist or not. We've also developed a number of resources that they can give out to pregnant women, and I brought some here today, which are available in a lot of New South Wales health services, and that just gives them some information about their oral health and needing to see a dentist. So we found that the midwife was a really good, middleman to actually connect women to the dental service. However, one problem with the model of care that we've taken is that it's very mainstream. And so vulnerable populations like Aboriginal and Torres Strait Islander women, which is who I'm doing my research with, often don't access antenatal services until much later in the pregnancy, and they don't access them as frequently. So we wanted to see, okay, who do they actually see? So we went to the community and we worked together with the community to identify that actually Aboriginal health workers are ideal people, the middleman for Aboriginal women to access for their antenatal health, and they see them antenatal appointments. So in New South Wales, we've linked up with a couple of Aboriginal antenatal health services to actually develop this program for Aboriginal health workers to train them like we've trained the midwives. And actually we are also working with Victoria as well to develop this training program. So this is some of the stuff that we've been doing, and we found that it's been hugely successful with the midwives and the pregnant women. It's improved their confidence and knowledge in delivering oral health information and referring them to the dentist. But with the women, we've also found that it's improved their knowledge, their access to dental services, and also improved their oral health outcomes.
Thank you so much, Ariana. It'll be very interesting to know what it's like even to work with, African women and even African migrant women and refugees, and even African women at home or wherever they may be. But I guess the main thing is that, with pregnancy, it's very important to be aware of the implication of oral health on, pregnancy outcomes. Now, maybe one or two, I'm aware that you mentioned some of them earlier in terms of signs and symptoms of oral health issues during pregnancy. Apart from the bleeding gums, are there any other things that you want to mention as signs and symptoms of oral health issues during pregnancy?
Yeah. So you might notice that your gums, this is particularly with more severe forms of periodontitis, might recede a little. They might get a bit swollen, tender, and sore. You might experience sensitivity with your teeth. Also, you might notice that there are white spots that appear on your teeth. And you also might see little holes in your teeth. So those are the cavities that I was referring to as well. Also, you might experience, pain, bad breath, toothache. So, if you're having any issues with your oral health, then it's probably good to then see a dentist.
Thank you so much. The last question I'm going to ask is, how can we then prevent those oral health issues during pregnancy, especially when you spoke about, some hormonal changes, that take place when a woman is pregnant. Just generally, how can oral health issues be prevented during pregnancy?
Okay. Well, I have maybe 4 key messages to just to give. First one is eat well. Really important to eat just a healthy, balanced diet. And I know even though it's really hard with the cravings for the sugar, actually it's ideal if they can cut down as much as possible. In terms of drinking well, so that's my next message, drink well. So drink tap water and try to avoid caffeinated drinks, fruit juice, eat fruit instead of having fruit juice, and avoid soft drinks. The third point I have is clean well. So, I think all women kind of know the obvious. You need to brush your teeth, make sure you floss. But actually, one thing that some women may not know is that, if you have morning sickness and then after you throw up, it's actually not good and not advised to brush your teeth afterwards. What's best and is actually just, rinse your mouth out with water and then just grab a smear of toothpaste and just put it along your teeth and that should be fine. Finally, I would say stay well. So by this I mean, go and see the dentist if you're planning a pregnancy. Try and see a dentist before you get pregnant, or if it's during a pregnancy, see the dentist. In saying that, there might be a few misconceptions among the community about the safety of seeing the dentist during pregnancy, and the research has shown it's completely safe. Pretty much all treatments are safe for women during pregnancy, and of course, depending on where you are with your pregnancy and how complex your issues are, you might have to just get specific advice from your dentist. I just wanted to add one more thing. So those were the 4 points. So they were eat well, drink well, clean well, and stay well. But what about after pregnancy when your child gives birth? Because I mentioned earlier that the mother's oral health can actually affect the oral health of their child. So there's a bacteria in our mouth that actually that causes the cavities. So that's how we get the holes in the teeth. And a common method of transfer for the bacteria is when the mother shares their spoon with the baby, and then she eats a little bit and then gives the baby a little bit. So that actually transfers the bacteria that can cause the cavities in her mouth. So try not use the same spoon. If if the baby has a dummy and it falls onto the ground, try and wash it with water. Don't use your mouth to clean it. And then when you put your baby to bed, don't leave the bottle in their mouth. Take it out and make sure. Otherwise, that can also contribute to it. And then finally, it's advised that the baby actually sees a dentist before 2 years of age, just to see how they're going and get them used to seeing the dentist.
Wow. Thank you so much, Ariana. And that is going to be how we will end the program today. Once again, we want to thank you, Ariana, despite the fact that you are very busy. You still made it to come to the program today. We're indeed grateful. And to my audience, thank you so much for being there with us today. I really appreciate your time. Until next week, when we come your way again, next week, please stay tuned. We'll bring another important topic, specifically on eating disorder. We'll look at that topic next week. And until then, it's bye for now.